Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, my Fatma Hitami. Ladies and gentlemen, this day is an exciting day. I'm very pleased indeed to see you all this afternoon, and it is also a big honor for me to give you a speech in this great chance. Ladies and gentlemen, the single most important thing that I want to share with you today is that health is the main or the most basic thing for someone to be able to carry out their daily activities. If one breadwinner is not healthy, he will not fulfill his obligation to work and earn money for family needs. Like with the application of economy as a priority and health being number two, business will not return to anything near normal until the public is convinced it is completely safe to do so. And only ongoing public health support and guidance can provide that assurance. Because basically, the economic needs a strong public health foundation to grow and to develop. Therefore, we would like to propose the most effective application in maintaining health regardless of economic stability during the corona pandemic. So I'm going to convince all of you that strict lockdown means effectively reducing the number of people who can, can be exposed to the virus despite the interest of economic stability during the corona pandemic. Health priorities are mandatory for now and the survival of the nation in the future, rather than concern with the economy. Without assertiveness and ongoing fulfillment of the economy by opening shopping places and other sectors, the community will continue to go out, and the worst thing that can happen is to meet other people who can transmit the virus just by accidentally touching each other while in the road or in the public transportation. Because maintaining health only by using a mask and social distancing when leaving the house is not effective. The risk of transmission of the virus is still great. The implementation of a massive strict lockdown is very effective if it is really implemented in a disciplined manner by all groups. However, this application must be accompanied by assistance for the community from the government periodically. This aims to ensure people's lives so they don't go out of the house and to living during this lockdown. The government must pay attention to the health priorities of its citizens by providing firm treatment, namely a massive and strict lockdown, and by continuing to pay attention to equitable assistance to the community. Referring to data on the Spanish flu pandemic in the US, the research showed that in 1918, when the flu pandemic hit the US, cities that prioritized public health over economy experienced higher economic growth than those that didn't. It is based on the research too conducted by Bishop that Korea et al. Found that how different the Australian economy is now. The Spanish flu period and the strong economic growth that followed shows that rapid recoveries from pandemics are possible if the public health aspects are not too prolonged. Another source said that although China became the center in the first day of the pandemic, Italy passed China with the emerging cases. Even though Italy suffered severe injuries to the pandemic, Italy have managed to control the number of COVID-19 cases with the lockdown for a long time. The implementation of a massive and strict lockdown will reduce the number that can be affected by the corona, so that a significant change will result in the rate of the corona chart in Indonesia. Thus, after the number corona decreased in Indonesia, the possibility of transmitting the coronavirus to other people was very small, because this small number had been handled in a special hospital as soon as many people are healthy. As a result, the economy can start to run back to normal and experience high economic growth for the nation. That's all my speech today. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.